Hi, I'm Bela Matyas. I'm the health officer for Solano County. So a question that we've been asked a fair bit are what are the signs and symptoms of COVID-19? So I think it's helpful to think about the respiratory tract in general. It's typically the upper respiratory system and then the lower respiratory system. And most diseases affect one or the other, some affect both. In the upper respiratory system, if you have an illness like the common cold, you expect to have a runny nose, you expect to have maybe watery eyes, itchiness, some cough that starts from the throat, maybe a stuffed nose. By contrast with the lower respiratory tract, we would typically have a deeper seated cough. You might have, often will have a fever associated with it. You might have shortness of breath. So the types of symptoms overlap, but generally speaking with COVID-19, it's the lower respiratory tract that we're worried about becoming infected. The only complicating factor is that a lot of people have chronic coughs. So if we're asking somebody about whether the cough may or may not be related to this, it's important to ask if it's a recent onset cough rather than a cough that they typically have. And with that in mind, diseases of the lower respiratory tract spread through respiratory droplets. And so our guidance for social distancing and regarding events has to do with, will that event increase the likelihood that that type of transmission will increase? So again, people routinely share their respiratory droplets with family members and with friends. And so if the event only involves the same people you socialize with anyway, the event's not going to change anything. If the event involves you interacting with strangers and having that type of sharing more likely to occur, then that's an event that we're recommending not go forward. So there's really not a minimum number. It's more a matter of what kind of an event is it and what are people likely to do. It's pretty obvious that a larger event is more likely to have that kind of transmission because it's going to be harder to stop that from happening. And so rather than saying any event above 250 you shouldn't do, it's more a matter of what is the event, what is the nature of it, is there an increased risk of amplifying droplet transmission by interacting with groups of people you don't normally interact with. And so for our people who go out into the field and interact with our clients, you know, the thing you want to do before you go is assess whether or not there is anyone in that family having a respiratory illness. So you want to ask, are there people in the family having a recent onset cough, fever, shortness of breath, or any of those symptoms? And then you don't want to go to do that home visit. You want to reschedule it. You can always carry with you surgical masks, and if somebody had not indicated that they're having that happen, but you find when you arrive that they do, you can ask them to mask and mask yourself, and you'll greatly reduce the likelihood that droplets can transmit. And be really careful in those situations not to bring your hand to your mouth or your face at all during that interaction. And when you're done, wash your hands either with soap and water before you leave or with a hand sanitizer before you bring your hand to your face. As for how are we doing here in the county, you know, it's often asked by a lot of people, how many cases do we have? And I have to say, that is really an irrelevant number. We have no clue how many people have disease in Solano County because it's widespread throughout the community. And very few of the people who have the disease have any clue that they have it. They have mild symptoms or no symptoms at all. Even those with symptoms, by and large, they're not going to get tested if they're able to stay home with their illness and they don't need hospitalization. So the numbers that we're reporting, at this point, they're still under 10. But that doesn't mean we've only had 10 real cases in Solano County. We've had way more cases, we just have no idea. And now that testing is being done by commercial labs in addition to the public health laboratories, our ability to keep track of that will become even harder. But I don't think that's the point. Having the number should not cause you to think differently about how to interact in your community. You have to assume universally that people with respiratory illness may have coronavirus and interact with them in a way that protects you. It is helpful to know that so far, in testing from both South Korea and from the US, it appears that only a very small percentage of people with respiratory illness being tested actually have coronavirus. So we have to remember we still have flu and all these other diseases that are passing around in our community as well. As for how you can get tested if you want to, I would reframe that to say that we aren't going to test you just because you want to. That's not a useful reason to be tested for coronavirus, especially since there's nothing we can do with the information. If the information affects how your medical care will be delivered to you, then we want to know, and then we will test you. If a treatment comes along, then we will want to test people to know who we need to treat and who we don't need to treat. So right now, if you need to be tested, you will, and we have testing in the public health laboratory, at the state laboratory, and in the commercial sector. But you know, if you have a curiosity reason for wanting to be tested, that's not a good use of limited public resources. If you're sick, if you have the lower respiratory symptoms that we were talking about, you need to stay home until those symptoms go away, and then you can return to work. As for the status of our hospitals and their capacity to provide care, they're strained. But they're strained all through cold and flu season. They run at capacity throughout the winter because so many people have influenza and other respiratory diseases that make them sick. And so adding coronavirus to the mix has not been helpful to them. But that said, our hospitals are fabulous in Solano County, and they are doing an extraordinary job of making sure everyone who needs care receives care.